Imagine a condition so stealthy it creeps up on you without a single warning sign, yet holds the power to alter your life dramatically. Welcome back to Diabetes Fam, where we're all about mastering diabetes, understanding insulin, diving deep into diabetes management, exploring hypoglycemia, and staying on top of the latest diabetes research. Today, we're unraveling the mysteries of insulin resistance, the silent killer that could be lurking in your body right now. Often overshadowed by its more notorious counterparts, insulin resistance is the dark horse of metabolic disorders, setting the stage for type 2 diabetes and a host of other health issues. But fear not, with the proper knowledge, you can outsmart this silent adversary. Stay tuned as we explain what insulin resistance is, how it silently affects your health, and what you can do about it. Let's dive in. Insulin is not just a hormone. It's the key that unlocks our cells, allowing glucose, our primary fuel, to enter and be converted into energy. This process is critical for maintaining healthy blood sugar levels. However, when insulin's functioning is compromised, as seen in conditions like type 1 diabetes and type 2 diabetes, the consequences can be severe. In type 1 diabetes, the body can't produce insulin, leading to uncontrolled high blood sugars. On the other hand, type 2 diabetes and prediabetes arise from the body's inability to use insulin effectively, causing glucose to accumulate in the blood instead of being absorbed by the cells. This distinction highlights insulin's pivotal role in managing diabetes mellitus, a group of metabolic diseases characterized by hyperglycemia. Understanding insulin's role is fundamental for anyone grappling with these conditions, as it sheds light on why maintaining insulin levels within a healthy range is essential for preventing the adverse effects of high and low blood sugars. Insulin resistance, a condition where the body's cells become less responsive to insulin, is a complex issue with multiple contributing factors deeply intertwined with the broader spectrum of diabetes mellitus, including type 1 diabetes, type 2 diabetes, and prediabetes. While type 1 diabetes is primarily an autoimmune condition leading to the destruction of insulin-producing cells, thus unrelated directly to insulin resistance, the latter is a hallmark of type 2 diabetes and prediabetes. This resistance to insulin results in high blood sugars as glucose accumulates in the bloodstream instead of being used as energy. Several key factors contribute to the development of insulin resistance. Genetic predisposition plays a significant role. Individuals with a family history of type 2 diabetes are at higher risk. Lifestyle choices are critical, with poor diet, obesity, and physical inactivity as significant contributors. Excessive intake of high-calorie, nutrient-poor foods can lead to obesity, a primary risk factor for insulin resistance. Additionally, a sedentary lifestyle exacerbates the problem by decreasing the body's need for glucose as energy, further impairing insulin's effectiveness. Stress and sleep disturbances can also influence insulin sensitivity, making the body's cells more insulin resistant. Together, these factors create a perfect storm, fostering an environment where insulin resistance can thrive, setting the stage for high blood sugars and the progression from prediabetes to type 2 diabetes. Detecting insulin resistance can be challenging due to its subtle onset, but being aware of the early warning signs is crucial for managing and potentially reversing its progression towards more severe forms of diabetes mellitus, including type 2 diabetes and prediabetes. Unlike type 1 diabetes, which can manifest abruptly with severe symptoms due to the body's inability to produce insulin, the symptoms of insulin resistance and the consequent high blood sugars develop gradually, making them easy to overlook. Common early warning signs include persistent fatigue despite adequate rest and an unexplained increase in hunger, particularly for carbohydrates, as the body struggles to use insulin efficiently and cells do not receive enough glucose for energy. Frequent urination and excessive thirst are classic symptoms that arise from the body's attempt to eliminate excess sugar through urine. Weight gain, especially around the abdomen, is another indicator, as insulin resistance is often associated with an inability to manage weight effectively. Moreover, signs like dark patches of skin, particularly around neck folds and armpits, a condition known as acanthosis nigricans, can also signal insulin resistance. These symptoms serve as an early alert system, suggesting that insulin levels and blood sugar may not be adequately regulated, pointing toward the onset of prediabetes or the risk of developing type 2 diabetes. Recognizing and addressing these signs promptly can play a significant role in preventing the escalation of insulin resistance into full-blown diabetes mellitus. Insulin resistance, if left unchecked, can lead to a cascade of health complications, significantly impacting the course of diabetes mellitus, including the escalation of prediabetes to type 2 diabetes. This condition sets the stage for chronically high blood sugars, which over time can damage blood vessels and nerves, leading to a spectrum of complications affecting nearly every part of the body. Cardiovascular disease emerges as a primary concern, with insulin resistance increasing the risk of high blood pressure, stroke, and heart attack due to the detrimental effects of high glucose levels on blood vessels. Additionally, insulin resistance is a critical factor in the development of type 2 diabetes, characterized by the body's inability to use insulin effectively, further exacerbating the risk of these cardiovascular complications. The liver also suffers, as insulin resistance can lead to non-alcoholic fatty liver disease, NAFLD. In this condition, excess fat is stored in liver cells, potentially progressing to more severe liver damage. Furthermore, insulin resistance is linked to polycystic ovary syndrome, PCOS, in women, affecting menstrual cycles and fertility. It can even contribute to the development of certain types of cancer due to its association with chronic inflammation and hormonal imbalances. These complications highlight the urgency of addressing insulin resistance early, especially in individuals with prediabetes, to prevent its progression and mitigate the risk of developing further health issues associated with high blood sugars and diabetes mellitus. Diagnosing insulin resistance is a crucial step in preventing the progression to more severe stages of diabetes mellitus, including type 2 diabetes and prediabetes. Unlike type 1 diabetes, which can often be diagnosed through clear symptoms in the presence of autoantibodies, detecting insulin resistance involves assessing more subtle metabolic changes before they escalate into high blood sugars and overt diabetes. Healthcare professionals utilize a combination of blood tests to detect insulin resistance. The fasting plasma glucose and oral glucose tolerance tests are standard measures to evaluate how well the body manages blood sugar. An elevated fasting glucose level can indicate impaired fasting glucose, a form of prediabetes. The HbA1c test, which reflects average blood sugar levels over the past 3 months, can also indicate prediabetes or diabetes when the levels are higher than average. The fasting insulin level test, although not routinely performed, can provide direct insight into insulin resistance by measuring the amount of insulin the body produces in a fasting state. High levels suggest that the body produces more insulin than usual to compensate for decreased cellular sensitivity to insulin. Identifying insulin resistance early through these diagnostic tests is vital for implementing lifestyle changes and interventions that can significantly reduce the risk of developing type 2 diabetes and the complications associated with chronic high blood sugars and diabetes mellitus. Effective management and potential reversal of insulin resistance are pivotal in halting the progression to type 2 diabetes and mitigating the risk associated with diabetes mellitus and high blood sugars. Key strategies focus on lifestyle modifications that enhance the body's sensitivity to insulin. Incorporating a balanced diet rich in fiber and low in refined sugars and processed foods can significantly lower blood glucose levels. Regular physical activity is equally crucial. Exercise improves insulin sensitivity, allowing the body to use insulin more efficiently. For individuals with prediabetes or at risk of developing type 2 diabetes, weight loss can have a profound impact. Even a modest weight reduction can improve insulin resistance. In some cases, medications such as metformin are prescribed to lower glucose production in the liver and improve insulin sensitivity. These interventions underscore the importance of a proactive approach in managing insulin resistance, emphasizing that with the right lifestyle changes, it is possible to reverse this condition, prevent type 2 diabetes, and improve overall health in the context of diabetes mellitus. Preventing insulin resistance and its progression into type 2 diabetes or exacerbating diabetes. Mellitus involves a multifaceted approach centered on maintaining a healthy lifestyle. While type 1 diabetes, an autoimmune condition, is not preventable, strategies aimed at reducing the risk of type 2 diabetes and prediabetes are effective in managing insulin sensitivity and controlling high blood sugars. Key preventive measures include adopting a diet rich in whole foods, vegetables, lean proteins, and whole grains, which help regulate blood sugar levels. Regular physical activity is essential. It enhances the body's ability to use insulin effectively and manage blood glucose levels. Maintaining a healthy weight and avoiding obesity are crucial, as excess weight is a significant risk factor for developing insulin resistance. Additionally, monitoring blood pressure, managing stress, and ensuring adequate sleep can support metabolic health, further preventing the onset of insulin resistance and its complications within the context of diabetes mellitus. Preventing insulin resistance and its progression into type 2 diabetes or exacerbating diabetes mellitus involves a multifaceted approach centered on maintaining a healthy lifestyle. While type 1 diabetes, an autoimmune condition, is not preventable, strategies aimed at reducing the risk of type 2 diabetes and prediabetes are effective in managing insulin sensitivity and controlling high blood sugars. Key preventive measures include adopting a diet rich in whole foods, vegetables, lean proteins, and whole grains, which help regulate blood sugar levels. Regular physical activity is essential. It enhances the body's ability to use insulin effectively and manage blood glucose levels. Maintaining a healthy weight and avoiding obesity are crucial, as excess weight is a significant risk factor for developing insulin resistance. Additionally, monitoring blood pressure, managing stress, and ensuring adequate sleep can support metabolic health, further preventing the onset of insulin resistance and its complications within the context of diabetes mellitus. Understanding and addressing insulin resistance is fundamental in the broader battle against diabetes mellitus, including preventing the transition from prediabetes to type 2 diabetes and managing the risks associated with high blood sugars. While type 1 diabetes is a distinct condition necessitating lifelong insulin therapy, insights into insulin's role in all forms of diabetes underscore the importance of maintaining insulin sensitivity for overall health. Embracing lifestyle changes, staying informed about the latest diabetes research, and seeking early intervention can empower individuals to mitigate the impact of insulin resistance. Together, these efforts form the cornerstone of a proactive approach to reducing the prevalence of diabetes mellitus and enhancing the quality of life for those affected.